Michael had a family emergency and can't be here today. He was kind enough to share his slides, and Gordon McLennan, my co-moderator from Cleveland Clinic, is going to present that talk to us. Gordon.
Thank you, Scott. Are we bringing the slides up? There we go. All right. So I want to thank Mike for sharing the slides, and I hope everything goes well for him at home. So, all right. How do I advance this? All right, guys. The keys are not working, and the mouse is not working. All right, we are experiencing technical difficulty. The UFOs have landed.
Might have to get them to advance it from the back. Just take the
Yeah, we can advance from the back. Go ahead and go to the next slide. Great. All right, so the question we're going to ask ourselves today is, why do grafts clot? You know, clearly the risk factors for graft thrombosis is the underlying stenosis at the venous anastomosis in the draining veins. About 80% of the stenoses occur in the downstream veins or central veins. Next slide, please. So when we look at Schwab's original paper back in 1989, he looked at the dialysis venous pressures and monitored those to see whether looking at the venous pressures of the access grafts would decrease the thrombosis rate in patients. And so in patients with elevated venous pressures, he referred them for fishtulograms and or angioplasty, and was able to demonstrate a decrease in the thrombosis rate based upon his historical controls. This is very observational, very retrospective, and it was one of the early papers that sort of led us down this road to, if we can find a stenosis clinically or through surveillance, and we do an angioplasty, can we prevent a thrombosis of the access? Next slide, please. So there are many, many ways to do surveillance. Important and critical for us to pay attention to are the clinical monitoring parameters. Monthly evaluation of the access by the access center, looking for abnormal bruits, abnormal thrills. Increased edema and swelling in the arm can be an indication of a downstream occlusion. Prolonged bleeding can be an indication of downstream stenosis that's causing increased pressure in the access. Aspiration of clots can mean one of several things. It can mean a decreased inflow